Caro dottor Barnes, grazie innanzitutto per aver accettato di darci questa sua breve presentazione a commento dell'articolo recentemente comparso su Circulation che noi abbiamo letto con grande interesse e che condividiamo completamente. Grazie ancora e buon lavoro.
Hello, my name's Geoffrey Barnes, and I'm a cardiologist at the University of Michigan. Thank you for inviting me to speak briefly about my vision for anticoagulation clinics in the era of direct oral anticoagulants. I've thought a lot about how anticoagulation clinics are going to need to change over the next few years now that we have multiple oral anticoagulants to choose from. I see three important things that anticoagulation clinics should do as we move here into the 21st century. First, I think they have an important role in helping physicians and patients select the most appropriate drug. This is important to incorporate a shared decision-making model so that patients feel like they're an important member of the decision-making process and they select the anticoagulant that best fits their needs. Secondly, I think the anticoagulation clinic can expand its role in helping to minimize any bleeding risk associated with taking an oral anticoagulant. That can include making sure that the direct oral anticoagulant dose is most appropriate for the patient, especially knowing what other medicines they're on. It includes the traditional role of titrating the dose of warfarin or another vitamin K antagonist as they currently do. But I think it's also important to help our patients monitor for renal dysfunction. We know that this is one of the most important pieces in helping to determine the most appropriate dose of a direct oral anticoagulant. And finally, I think our anticoagulation clinics can have a really important role in helping manage patients who are on an anticoagulant and need to undergo a surgical procedure, like a colonoscopy or perhaps having a gallbladder removed. Making sure that providers know when to stop and when to restart their anticoagulant is an important thing that the anticoagulation clinic can coordinate and help to communicate effectively. Finally, as we've seen in some recent publications, I think the anticoagulation clinic has a very important role in helping our patients maintain high adherence to their medicine. We already do this with patients taking warfarin or other vitamin K antagonists, but there's an important role in the patients who are on a direct oral anticoagulant. The more often those patients are in contact with a nurse or pharmacist in the anticoagulation clinic, the more often their questions will be answered and they'll be reminded to take these very important and potentially life-saving medications. So I see these as the three important roles in how the anticoagulation clinic can expand and incorporate patients on all forms of oral anticoagulation as we progress through the 21st century. And I know Dr. Palloretti is going to have many other recommendations and visions as well. Thank you.